Hi everyone, I'm Dr. Venkatesh Murthy, practicing oral implantologist. I'm basically into basal implants. I do conduct workshops on basal implants and also one-to-one interaction teaching for the doctors who are interested to learn basal implantology. If you can enroll with my workshop or if you are contact me for one-to-one interaction, I'll give you a full mouth case. I will allow you to place implants on the patient, and along with the teaching hands-on, hands-on, I will explain and I'll teach you in detail. So I'm ready to explain you everything, whichever the doubts you have about basal implantology. I will clear all your doubts and I will give you the case also, and I will support you whenever you have case in your clinic. I will come and support, or otherwise through video call I will support you. I will see to it that you are going to place the basal implants. So I am more into full mouth rehabilitation cases as well as the partially edentulous cases also. In full mouth rehabilitation cases, I've used two types of basal implants. Basically, there is basal cortical screws as well as the compressive screws. These are the main types of implants used in basal implantology for full mouth cases. Okay. There is one more type of implants, that is PTA, tuberopterygoid implants. Okay. These tuberopterygoid implants are used in the tuberosity area involving the tuberosity as well as the posterior maxilla. This will give you a good stability when you place an implant in the full mouth cases. Okay. In a full mouth case, full mouth rehabilitation case, the main three types of basal implants used will be the BCS, compressive screws, as well as tuberopterygoid implants. Okay. There will be different designs, different length and different dia of the implants. So you have to evaluate and investigate the case through your OPG or CBCT. So after going through your CBCT as well as OPG, you will come to the conclusion which length and which dia implant you want and which design you want. Okay. Depending upon the availability of the bone, especially in basal implantology, the bone which you need is the cortical bone. Okay, the cortical bone is available in the nasal floor, it's available in the pterygoid plates, it's available in the lower anterior mandible, and in the upper posteriors and the lower posteriors. Usually, the main bone will be the cancellous bone there. So there you are going to use the compressive implants there. So different regions need different kind of implants. So when you are planning a case for full mouth rehabilitation cases, first we have to thoroughly study about the case. Any medical history of the patient. For example, the patient is diabetic or hypertensive, or if the patient has undergone any kind of radiation therapy, all those things. Taking everything into consideration, you have to evaluate the patient, whether the patient is ready for such kind of treatment. Then only you will go for full mouth cases in the aged patients. Okay. Usually in the aged patients, what happens is the patient will be using one or two sets of dentures they will be using for a long time. So after the main complaint about the patient is that there will be ill-fitting dentures. So these kind of patients, they want something fixed. So something fixed means there should be bone should be there. If there is no good bone, you cannot do the implantation. You cannot do the basal implants. The main bone which is needed and available should be the basal cortical bone, that is we call it the bicortical bone. Okay, if it is there, so you can do full mouth rehabilitation in aged patients also. Okay, till now I have done some 25-26 full mouth rehabilitation cases, including in my clinic as well as wherever I go as for consultation. Okay, so full mouth rehabilitation cases is much more important when compared to the partially edentulous cases. In partially edentulous cases, you can place the conventional implant also. Okay, I was a conventional implant practitioner before. I have done many all on 4 and all on 6 cases. Now I am completely teaching and practicing basal implantology, which is really good and is the happening thing in dentistry. The main advantages of basal implantology using the basal implants is that the treatment period will be less. There will be less trauma and less treatment time for the patients. It will not be traumatic for the patient. You are not going to give any incision, you are not going to raise any flap, or you are not going to use any, the graft material or the membrane, whatever, which is needed in conventional technique. Here, no graft, no incision. Okay, so less trauma for the patient. One drill or maximum 2 drill technique. After that, we are going to place the implant directly. So these are the simple techniques used in basal implantology. So I have explained about the selection of the cases. I have explained about the different types of implants used here. In the next video, I will discuss with the 1 or 2 full mouth cases. Thank you so much.